So last week we talked about all the sensors on the top of your skin. Um, Today we'll talk about the sensors located inside, underneath your skin, and they are the ones that tell you about where your limbs are and help you in producing movements and reflexes. So, I'd like all of you and all of you watching this on video to try this. Close your eyes and try touching your nose. Can you see how accurately you can do that? It's amazing. If you think about it, that's quite a feat, because your brain has to know not only where your finger is in space, but to do that, it has to know where your hand is relative to your forearm, where your forearm is relative to your upper arm, where your elbow is, where your elbow is relative to your shoulder, and it's got to figure out and know the length of all those things, and then compute that movement. Okay, so that's not easy, and we'll go over today all the processes by which it does that. And it uses two things. One is proprioception, your sense of position, but also uses something called kinesthesia, which is your sense of movement. Now, you notice that you touched your nose, even though you could move your fingers pretty fast, you know? And so why is speed important? Well, you have to know how fast you're going in order to know when to brake, start slowing down the movement. You slow down the movement before you hit the nose, just before you hit the nose. So you sort of get the peak velocity in the middle of the movement and then slow it down afterwards. So knowing speed is important. Now, inside your arm, you've got all kinds of receptors. One of these is called spindles. They're sort of afferents that are located inside your muscles themselves. And they're good for giving you a sense of what the position, how long that muscle is, and how fast it's changing its length. And from that, you can then compute the position and velocity of your joint that the muscle is attached to. The other sensor is at the ends of your muscles. You have things called Golgi tendon organs, and they basically tell you how hard the muscle is pulling. So it helps you regulate the force the muscle is exerting. Then over here, within the joint, and so between the bone of your upper arm and the bone of your forearm, in this joint, there are joint afferents, and they also help you determine what position the limb is in, but they're particularly sensitive to the extreme joint angles, like extreme extension or extreme flexion. Oops, I didn't go over another one. Another one that's important is the one we took last week, the tactile receptors. Remember, especially in the fingers, that the SA2 afferents, these guys here, the ones located deep in your skin and slowly adapting, they help you tell whether your hand is curled or extended, and help you signal the position of your fingers. Now, The other sense you have is an internal sense of effort, and that's like the corollary discharge. So when I send a signal to my muscles, I expect it to move, even though maybe I don't feel that they're moving. Okay, it's from the corollary discharge that's coming from the signal that's going to the muscle. It's also important. Now, the different receptors provide different information. So the spindles I mentioned are important for both position and velocity. The Golgi tendon organs at the ends of the muscles are good at knowing how much force the muscle is exerting. And all of them signal some sense of position, and the brain learns to rely on the ones that are most accurate. And these can change for the different body parts. For the fingers, for example, the tactile receptors are very important, and less so for your shoulder. Now, if you lose a receptor, other receptors take over. For example, if you get an artificial hip, for example, after a while, people's hips wear out, or people's knee joints wear out, and an artificial knee joint or artificial hip is put in. So you lose these joint receptors. So other receptors take over. If I were to anesthetize the skin on your hand, so one way of doing that is putting a cuff on your arm here and restricting the blood flow. And of course, restricting the blood flow will then cause your fingers to become anesthetized in a sense. And you won't feel the signals from your touch receptors. But because the muscles that move the fingers are located here in the forearm, and they pull the fingers by long tendons that attach to the different joints in your fingers. The spindles within your muscles aren't affected, and they will still be able to tell you what the position of your fingers are. And lastly, there's corollary discharge. So I read an example of a patient who drove a standard car, and then he developed a disease which caused him to lose all afferent input from his arms and legs. So he lost all these receptor signals. But he found he could still drive his manual car. So he used corollary discharge. If he pushed the arm in a certain way, he expected the arm to go in a certain way. That's corollary discharge. So he had a sense of which way the command went out. He then found the car got old, and he had to get a new car with a different transmission. Not the same amount of force was needed to push it in different directions. And he found he couldn't drive it. He had to rebuy his old car, fix it up, and continue driving his old car. He couldn't learn because he had he had lost those afferents, how to drive this car based solely on what exertion he sent out, because he had to now send out a different exertion. He could use vision to help guide him, but of course that would be a dangerous thing to do while driving a car. Now, so I mentioned spindles. The spindles of Golgi tendon organs are located in different positions. The spindles are located in parallel with all the other muscle fibers. So this is a spindle. A muscle fiber would be in parallel with it, running alongside the spindle. And that's good because whatever length the muscle fibers are is the same length as what the spindles are. In contrast, the Golgi tendon organs are located at the ends of the muscles. They're located within this tendon that attaches to the bone of your joints. And when you contract your muscle, tell it to exert a force, you lengthen this tendon, and that stretch is what these Golgi tendon organs signal. And in this case, the muscle is here, the joint is here, so that's in series with the afferent is in series with the muscle, whereas before the afferent was in parallel. So this makes the Golgi tendon organ exquisitely sensitive to the force the muscle is exerting. Now, within the spindle, you've got these things called bags and chains, and we'll discover that they're similar to muscle fibers outside in elsewhere in the muscle. But around these muscle fibers, this one's shaped like a bag here. This one sort of has a straight shape. You've got afferents wound around it, and they signal how much this middle portion is being pulled. Now you have, here you can see a thick afferent and a thin afferent. The thick afferent is given a name of 1A. The thin one is given a name of 2. The thick one comes from both the bag and the chain. The thin one comes from just the chain. Now these numbers, the 1B, there's a 1B, and that comes from the Golgi tendon organ. And these numbers, 1A, 1B, 2, signify how thick the fiber is. And how the thicker it is, the faster conducting it is. And so you know the 1A is the thickest of them all, and the 2 it will be the thinner of these three. Now, a bag fiber, the afferent attached to the bag fiber is interesting because it only fires during the stretch, and its firing rate depends on how fast the stretch is. So it's silent when when it's not being stretched or being relaxed. But while it's being stretched, the response that it gives is proportional to how fast it's being stretched. So proportional to the velocity. Now, the ones attached to the chain fiber, the one without the bag, it has a thick one and a thin one attached to it, and both signal the length of the fiber. That is, they give you a position signal. And finally, So what happens then during a passive stretch? If someone was to take your arm and stretch it like this, okay, or even me stretching it like this myself, I'm not, the muscle itself is not active in that process. My bicep is the one that's being stretched. My triceps is the one that's doing the stretch. So the biceps isn't exerting any force. So these guys are quite silent because not much force is being exerted. In contrast, these guys are very active. You can see the green action potentials are coming here from the bag, and you can see the green appearing only during the stretch. The other guys coming from the chain are the red signals, and they tell you that they're proportional to how long this muscle has become. And you can see they're always active, but they become more active when the length is longer. And they're coming, the 1A is getting a signal both from the red and the green, so it has a sense of both the position and the velocity, whereas the 2 is just getting the red signal from the chain fiber and is just sensitive to the position change, the length of the fiber. Now, in contrast, if I were to put my hand under the table and contract my biceps, okay, that is, try to lift the table up, well, what would happen then is that my muscle would contract, these fibers would get shorter, the tendon would get longer, these fibers would get shorter, so they stop firing, whereas the tendon gets longer, and so the Golgi tendon organ becomes very active. So that's called active contraction. Okay, one other complication, as if it's not complicated enough as it is that the brain can send a signal to the spindles, and that's called gamma activity. And there's 2 types: static, which goes to the chain, and dynamic, which goes to the bag. So this is just, they should have called this a gamma bag or gamma chain, but they have this other name for it. In a sense, it makes sense because static is sort of a position thing, or dynamic is sort of a velocity thing. Now, what happens when this action potentials come down these fibers is that they contract. These are, as I said, like muscle fibers. So they're able to contract, but just at the ends. Okay? So when these ends contract, like now, they pull the middle of it and make it longer. When they make it longer, they make it more sensitive. So when the middles get longer, they turn up their volume, you can think of. It's like these gamma signals from the brain are a volume control on your muscle spindles. Now, what happens with no gamma? Well, so nothing's increasing. So it's the usual thing. The usual thing is that when you stretch, this sends out more action potentials, so there's more red or orange action potentials coming down both the 1A and the 2. And while you stretch, there's action potentials coming down from the bag to the 1As. Okay? Those green dots coming down during the stretch. Now, if I increase the gamma, in this case, the gamma static that goes to the chain, you can see what has happened compared to what's happened before is the number of action potentials coming down is more. So both the 1As and the 2s are more sensitive to the stretch. So they signal a higher signal to the same stretch. So when the muscle gets longer, they give more action potentials. But even when the muscle is shorter, they give more action potentials. They're more sensitive to the stretch. Now, when I increase the gamma, which goes to the bag fibers, I make the afferent here more sensitive. And as a consequence, during the stretch, it signals more action potentials. More green dots come down to the brain. Okay. If we saw before that when the muscle contracts, this gets shorter, and of course the action potentials coming from the spindle stop. You can see this lack of action potentials. If, however, we have gamma coming down at the same time as alpha, alpha is a thing that's contracting your muscle. Gamma is a thing that's contracting your spindle. Okay, so this is called alpha gamma coactivation, and usually in many movements, you have a combination of the two. And when you have a combination of the two, the spindle remains sensitive, so it isn't being shortened. It remains sensitive, and as a consequence, if you bump into something, it reacts to that disturbance, and your reflexes can correct for that disturbance. Now we'll look at what happens with these afferents to 3 spinal reflexes involving 3 different receptor types. We'll see what the circuit is, we'll see what the stimulus and response is, and from that we'll discover what the function of that reflex is. So the first one to look at is the monosynaptic stretch reflex, which is activated by the spindle. Okay. So here we see the muscle length increase, and you get more action potentials coming from your spindle, and these action potentials go around the circuit and contract the muscle that was being stretched. Okay. As a consequence, when these action potentials come to this muscle, the muscle shortens. So this afferent is regulating the length. If the length increases, the afferent becomes active, and it decreases the length. Now, because there's only one synapse in your spinal cord for this circuit, and because the 1As are the thickest of all the fibers, this circuit is very fast, and so the response to anything that happens is very fast. This has the shortest latency of all your spinal reflexes. Another one, whoops, not quite right, this animation. This dot is not supposed to stay here. Well, it's supposed to be coming down. Let's try a replay. So let's suppose there's too many of these coming down. You don't see that happening here because this is not, animation isn't working quite right. I thought I'd fixed it. But if there were a lot coming down, this muscle would be too contracted. And as a consequence, you would stretch these tendon and you would have lots of activity coming down from your Golgi tendon organ. That would go through this circuit. Now this circuit isn't just one synapse, it's two. And this is an inhibitory synapse. That's why that you have the different color here. And what it does is, this is producing too many action potentials. This Golgi tendon organ comes and shuts down this muscle that's producing too many action potentials, okay? So it controls too much force, results in reduction of force. So this reflex is regulating how much force is being generated. Now that's important, for example, if you're holding something like a paper cup, to have just the right amount of force being generated. You can imagine if you're holding a paper cup, if it's too little force, the paper cup drops from your hand and hits the floor. If you generate too much force, you crush the paper cup and spill your coffee. So you've got to have just the right amount of force. And the reflex here is one of the things that helps you generate just the right amount of force. Another reflex is this one. It's mediated by pain and cutaneous receptors. And this is a reflex that's polysynaptic, lots of synapses coming. And it's going to the same side that was being activated, and also crossing over to the opposite side that's being activated. But we'll just replay what happens here. You step on the tack, and you get this muscle to contract. That muscle then takes the foot off the tack. At the same time, see what happens to the other side. That other side extends, okay? And it bears your weight so you don't fall over. So one side is being lifted, the other side is being extended, and you stay upright. Now, tremor. You might ask, okay, why not just keep the volume control up to its highest? Put out a lot of gamma and be as sensitive as possible. Well, the problem with that is if there's slightly too much sensitivity, you can get something called tremor. And I don't know if you've tried threading a needle or doing something when you're nervous. Your hand starts to shake a little bit, okay? That's called tremor. And normally what happens is the following. So what you saw there was a stretch of this muscle and a contraction of that muscle. And then when this muscle is being contracted, you're stretching this muscle and then contracting it. So this is the stretch, and then you contract it. That second contraction causes the limb to stop moving. Okay, so the stretch, then this muscle is being stretched. It then stops the movement of your forearm. Okay, it contracts and makes this still at a position that you want it to be. So you've got this complex circuit here. And this is just repeating it. Now this is what happens if your gamma activity is too high. Okay, what happens is too many action potentials are coming down here. That causes this muscle to contract too much. That big contraction pulls this muscle too hard. It produces a lot of action potentials, and rather than stop the movement, turns it around and has it go the other way. And that just keeps going forever. Okay. So this is why you have to keep the spindle activity just right for the task that you're doing. Now, in addition to this reflex through the spinal cord, there is another reflex that goes up here through the thalamus to area 3A and then to the motor cortex, which sends an axon down the spinal cord to the muscle, to the same muscle. Okay, so this muscle gets two responses when it's stretched. One short one that goes around the spinal cord, and a longer latency one that goes up to the brain and back. Okay. This signal up to the brain and back is can be controlled by other parts of the brain, one of which is the cerebellum. And with the cerebellum, you can tweak these reflexes for the task at hand. So let's say you're playing a game with catching a ball. Well, catching the ball depends on the expected weight of the ball. So you catch it differently depending on what your expectations are to the weight of the ball. If you're, for example, playing with a baseball, you'll have a different reaction to playing with a tennis ball, or even different to a ping pong ball. Okay. So this reflex here makes this whole reflex more sensitive to the task at hand, and so it adds skill to all your movements. So you can see that here on the screen. We're producing vibrations of the tendon. That in turn activates the muscle spindle, producing more activity in the muscle spindle. So the muscle spindle is sending out as much activity as it would be appropriate for that length, plus the extra ones that we produce by the vibration. Okay, this makes this send out more action potentials than it would normally. So the other arm, so the brain estimates that this arm is more extended than it really is, and the subject then indicates that by extending the opposite arm to a more extended length. Okay. Now, most activity involves alpha gamma coactivation, I mentioned. So how does this work? How do you send out, I'm trying to get back into the position, I can actually see my screen. So how does the muscle produce as much activity when it's contracted or relaxed and still know what the correct length is. We saw that when I did the vibration, that vibrating this tendon and activating the spindle more made the brain think this was a more extended length. Well, the same would happen if I produce more gamma activity. I would increase the sensitivity of the spindle and produce more action potentials. But I can still tell that my arm hasn't changed length to when it's not contracted. How does it do it? Well, it does it by corollary discharge. So the brain sends out alpha gamma coactivation. Alpha contracts the muscles, gamma changes the spindle activity. That comes back up through the spindles to this up someplace in the brain that compares how much alpha gamma activity is being sent down to how much spindle activity is being sent back up. And by comparing those two, it can sense the true position of the arm. Now, so when it's relaxed, there'll be little increase in the sensitivity, little afferent signal coming back, and it's being compared to little gamma being sent down. In contrast, when there's lots of alpha gamma activity, a high amount, there's high spindle sensitivity change. There's, as a consequence, a much higher spindle activity coming back up, but that's being compared to a high corollary discharge. And as a consequence, the brain senses the same level of activity in both these two cases. Okay. Next, instead of touching your nose, close your eyes and try putting your two fingers together. Okay? So to know where to put one finger next to another finger, you've got to know the position of this finger, and you've got to know the position of this finger to be able to touch the two together. Now, what's the problem? We mentioned that at the beginning of the class. Well, first of all, where does it go? You get a signal that goes to area 3A. This is 3B. This is where all your cutaneous signal went. 3A is just in front of it. This is 4, where all the muscle activity comes from. Activity coming down, back down the spinal cord to contract the muscles. So you have your body parts laid out in both 3A and 3B. So over here you got, for example, the signals coming from the joint. Okay, so this gives you the elbow angle. Okay, but you have to know more than just the elbow angle. Okay, so at some other place in your map here of the body parts, you've got your finger angle, and some other place you've got your shoulder angle. So all along here you've got the different angles of the different joints. And what the brain has to do is add up all these angles and, of course, know how long these different limbs are. And from that, compute where the finger is relative to your nose or the other finger. Okay. So it's got to do this complicated computation. The interesting thing is that when you're a child, all these limbs are shorter, okay? So you have one composition. As you grow up, these limbs get longer, and you learn to recalibrate for that, okay? So sometimes when you're a teenager and you seem awkward, it's because you're trying to recalibrate all these angles. Your legs, the same thing, are getting longer, different angles, and you have to react differently as you grow, both in terms of keeping your balance and in performing different tasks like catching a ball. Now, again, we have all your different angles being mapped onto 3A, and these signals flow back into your wear stream that we talked about before. So that in the interparietal sulcus, all these signals get added together, and from that you can compute where your hand is with respect to yourself. So this is where all these computations occur. So one thing to notice is that this is a nested egocentric frame of reference. So if you change this angle, you change the position of all the joints that it's attached to. You change the position of your elbow, you change the position of your fingers. So these joints are nested within this angle. Same thing for this. If this changes, then all the positions of all your fingers change as well. So this is something like that nested frame of reference, the allocentric one that we talked about when we had an apple on a table in a room. So when you move the table, then you move the apple with it. So the same thing here. When you change this angle, you move all this stuff with it as well. Now, we have a wear stream, which tells you where all your body parts are located. And that originates in the muscles and joints that we talked about today. In addition, we have a what stream. So we have afferent information coming from your skin and also from your 3A areas, but it flows this way to the side of the brain, and there's an area here called S2, the secondary somatosensory area, and this is where you get your sense of what the object is. When the last week's lecture, the student reached into the bag and pulled out all those objects. It was this stream that was being activated in order to determine what the object was. So again, you like in the other visual system, like in the visual system, you've got a where stream heading this way and a what stream heading that way. And of course, if you don't have that, you can't recognize objects. If you don't have this one, you can't recognize objects. If you don't have this one, you have a lot of trouble making movements. Okay, that's it for today. See you next week when we'll cover sound, how you hear.